Coming up, a portion of a popular marina collapsing today. Also, parts of the Rand Memorial Hospital to be demolished over the next few days. And the Ministry of Health providing more information into the related deaths of COVID-19. The Bahamas Tonight, the Northern Edition, starts now.
This is the Bahamas Tonight, Northern Edition.
Good evening, Bahamas. I'm Shashina Roll-Parkinson. As always, it is so great to have you with us. Topping news tonight, a part of a local marina located at a popular hotspot collapsing today. The incident leaving the owner with more questions than answers as the probe begins into what could have caused the startling turn of events. Pictures and video of a partially collapsed dock at the Port Lakai Marina flooding social media. When our ZNS News team arrived on the scene, we met the marina's operator, Preben Alton, on site, who says he was not on property when the incident unfolded.
I had no idea that it was about to collapse for sure. But as this area here has not been used as a marina since March of this year. So it's been closed. And no activities here, so I really don't know anything. We're right now trying to get to the bottom of what has happened and certainly get it repaired, whatever needs to be repaired. So
the area was cordoned off, and he says the work has already begun to investigate what happened and what needs to be done to rectify the situation.
I mean, the first thing, as you can see going on there right now, is we're cleaning the area, and all the debris that's come down is being hauled away right now as we speak, so we won't have any environmental issues there. And then secondly, we then have to make plans. We have to have structural engineers to come in and design what needs to be done, and of course it'll be fixed. We're kind of lucky that it's a quiet time right now. We have not a lot of customers in here, so that's very lucky.
Despite this startling turn of events, he says there is some good news.
No one was hurt, no, not at all. Not at all. Like I said, there's no activity here, there's no boats in the marina, there's no customers in here, so nobody was around. And definitely nobody was hurt here.
Well, tonight we have an update on construction underway at the island's premier healthcare facility. For the next few days, portions of the Rand Memorial Hospital will be demolished. And as the Grand Bahama Health Services Administrator tells us in this report, this process is making room for a new building and improved services. Jamila Mizik has the story.
The Rand Memorial Hospital is getting a much-needed facelift as construction work continues at the healthcare facility. Grand Bahama Health Services Administrator Sharon Williams says a demolition exercise is ongoing, tearing down about 40% of the facility.
Today, we are seeing the demolition of the old obstetric ward, part of the accident and emergency, the old accident and emergency, and we would have recently used that area as physiotherapy department, and then they will progress on to the administration building. So the whole of this eastern side of the hospital will be demolished within the next 2 days.
Williams says the good news is that this demolition process is making way for what they hope to be a new 3-story complex that would add much value to Grand Bahamians in terms of their healthcare services.
Of course, we will have the opportunity to place all of our wards on higher ground. Definitely a multitude of services that we have outside of the facilities at the moment because of space we would like to bring back, and that is areas like our accounts department that's off-site, our human resources department. Most of our clinics, our specialty clinics, are off-site, so it'll give us the opportunity to sit down and make sure that our services are again in a comprehensive site for better healthcare delivery.
She says this new environment will certainly be a great deal to healthcare workers as well as their patients.
I'm sure all of us will feel safer as healthcare workers having a structure that's better suited for the time and the environment. But more importantly, I'm sure all healthcare workers feel privileged to be a part of constructing a new area that's going to better serve the population of Grand Bahama in terms of delivering more effective healthcare to the population.
Jamila Mizik, ZNS Network News.
Thanks, Jamila. Well, as the country continues its fight against COVID-19, tonight the Chief Medical Officer is giving more details into COVID-19 related deaths.
You pretty much treat everyone as if they have COVID-19.
The war continues as health experts battle a virus that is impacting the world. To date, officials say there have been 67 deaths related to COVID-19. 8 non-COVID related deaths, and 10 under investigation. Chief Medical Officer Dr. Pearl McMillan giving a detailed report on the country's COVID deaths by sex and age group from the first COVID case back in March to date.
The vast majority, i.e. 69% of our COVID-19 deaths recorded in New Providence. A total of 65 persons have died, and 11 of these were in the first wave. Next slide. In this graph, we note the age and sex distribution of our COVID-19 deaths. In all age groups, more males, that's in the blue, are dying from COVID-19 than females. The exception is the 40 to 49 age group, where we see the pink bar much higher than the blue.
And here's what the report also revealed.
When we compare deaths across the first and second waves, which is on this graph, what we see is what is noticeable, most noticeable, is that 11% of our COVID-19 deaths in the second wave have been among persons under the age of 40, whereas in the first wave, we had no deaths in that age group.
But the fact remains that COVID-19 is impacting everyone, from the very young to the old. Dr. McMillan says COVID cases range from newborn to 99 years of age, which means no one is exempt. She adds that 41% of the cases are persons between the ages of 20 to 39.
Another 37% of our cases are for the age group 40 to 59 years old. There is almost equal distribution, if you look at the graph, and you see the pink and the blue, there is almost equal distribution between the males and the females. Within each of the 7 age groups displayed on the graph.
In other news, the Ministry of Health is refuting reports circulating on social media that government employees and hotel workers will be among the first to take a mandatory vaccine against COVID-19 once available or be terminated. Now, according to the ministry's Facebook page, that report is completely false. The ministry says in the Bahamas, no one is forced to take the flu vaccine that has been around for almost 78 years. For accurate information, the public is being encouraged to follow the Ministry of Health's Facebook page. And switching gears now, as the government gradually reopens various sectors of the economy, some local businesses are coping with day-to-day operations. In this report, Jay Philippe tells us how businesses in the downtown area are adjusting to the new normal.
Lockdown measures have been relaxed a little around the island of Grand Bahama. For many, it means a chance to get out and do things once considered normal. For businesses, it's an opportunity to capitalize on increasing their revenue. The downtown area has had its share of ups and downs, but for Cashwell Store, General Manager Mason Curry says they are grateful to be open.
A lot of persons are trying their best to get stuff for their kids, and computers, laptops, and stuff like that, things like that have been requested. But the difficulty is getting them from the States right now to bring them in. We normally do a system as a 30-day turnover, and because we was closed so long, we don't have anything to turn over to bring out. So we're giving people an opportunity to pay for their stuff because of COVID, and we understand and we sympathize with everyone who had their difficulties with the loss of jobs and everything. So we're giving them time. So that's restraining us from bringing stuff out on the floor to sell.
Over at John West Shoe Store, customers can be seen shopping for shoes as schools around the island are expected to resume on-campus learning October 5th.
Being able to be open now and seeing some senses of normalcy is relieving. And with the back-to-school season, we could see the stress on the person's face when they come in there to rush and get things for their kids. But it's just a situation that we're living in, and we're taking it one day at a time.
West says one of the biggest challenges the business has faced is restarting their operations with ordering new inventory.
When it comes to any retail business, timing is important. With us open and closing, that might have thrown the timing off a bit, with the months being basically empty months, that is. But we're trying to get on track. We're starting to get on track with the Valeria coming in and bringing in things, what's not, and we're getting it done.
Smaller stores like All About You clothing and accessory store owned by Tanya McIntosh has had some challenges with meeting financial deadlines, but McIntosh remains optimistic that sales will improve.
It's really quiet, but we try to put the customers first and support. We want the people of Freeport to support us, because we're here hopefully for the long haul, and if you come to support us, it's a partnership. We need you to help us. Right now, downtown is really, really needing a miracle.
She's hoping that business gets back to normal quickly.
To be honest, I thank God for my landlord. He's been very understanding. I've been other places where they just wanted the money, but he's been very helpful and he's been very understanding. So we work it out.
I'm Jay Philippe, ZNS Network News.
Hi, my name is Ricardo L. Dean, Associate Minister at St. Stephen's Baptist Church in Hatchet Bay, Luthra in the Bahamas. And today, I want to share a word of encouragement with you. You see, the world as we know it has changed. The coronavirus pandemic is wreaking havoc all over the world. Every continent, every country have been affected and infected. Many businesses have closed down and some may never open again. Many countries have gone into lockdown, creating new laws of operations hoping to stop the spread of the virus. Millions of persons have become infected and hundreds of thousands have died. Hospitals have run out of beds. The morgues are full of dead bodies, many unidentified. Doctors and nurses have become infected and many of them have also died. Some governments don't even know what to do. In the Bahamas, we have nearly 2,500 cases and nearly 60 deaths. So what do? Let's look to Psalm 27:14, which says, "Wait on the Lord, be of good courage, and he shall strengthen thine heart." Yes, wait, I say, on the Lord. So why do we wait on the Lord? Because he is the author and the finisher of our faith. You see, the world has proven to us that it has no answers to this pandemic. Only God has the solution. So he says to us today, wait on me. Yes, wait on the Lord. Psalms 41:3 reads, "I waited patiently for the Lord." This is David speaking. "And he inclined unto me and heard my cry." Yes, when you wait, God will hear. "He brought me up out of a horrible pit, out of the miry clay, and set my feet upon a rock, and established my goings. And he put a new song in my mouth." Hallelujah. "Even praise unto our God. Many shall see it and fear, and shall trust in the Lord." Here's what Isaiah says in 40:31. "But they that wait upon the Lord shall renew their strength." Hallelujah. "They shall mount up with wings as eagles. They shall run and not be weary. They shall walk and not faint." Listen to me today. Be encouraged today. You only need to know that God is on your side and victory is on the other side of this pandemic. Selah.
When we come back, we have an update on post-storm cleanup efforts from two areas in the north. The Bahamas Tonight, the Northern Edition, back in just a moment.